Hey there, science fans. Today we're diving into the world of hyponatremia. Sounds complicated? Don't worry, it's all about sodium, something we know and love, especially on those delicious French fries. But sodium isn't just about flavor, it's crucial for our bodies to function properly. Sodium acts like a tiny battery in our bodies, helping our nerves send signals and our muscles contract. It also regulates the amount of fluid in our blood and cells. Think of it as a tiny gatekeeper, making sure everything stays balanced. Without enough sodium, our bodies wouldn't be able to do amazing things like moving, thinking, or even breathing. That's why it's super important to keep our sodium levels in check. Now imagine our sodium levels taking a nosedive. That's when we run into a condition called hyponatremia, which basically means low sodium levels in the blood. Remember how sodium acts like a gatekeeper? Well, with hyponatremia, the gate's left wide open and things get out of whack. When our sodium levels drop too low, our cells start swelling up like water balloons. This can cause a whole bunch of problems, ranging from mild to severe. Headaches, nausea, and confusion are some of the early signs that something's not quite right. If left untreated, hyponatremia can even lead to seizures, coma, and in extreme cases, it can even be life-threatening. Yikes! So what causes this sodium imbalance in the first place? Well, it can happen for a number of reasons. Sometimes we lose too much sodium through sweating, especially during strenuous exercise or in hot weather. Other times we might be drinking too much water, which dilutes the sodium in our blood. Certain medical conditions can also lead to hyponatremia. Chronic kidney disease, for example, can make it hard for our kidneys to remove excess fluid, which can throw our sodium levels out of whack. Some medications like diuretics, water pills, can also increase the risk of hyponatremia. That's why it's important to talk to our doctor if we're experiencing any unusual symptoms, especially if we have a pre-existing medical condition. The good news is that hyponatremia is treatable. Depending on the severity of the condition, doctors might recommend adjusting fluid intake, changing medications, or in some cases, giving intravenous fluids with higher sodium concentration. Prevention is always better than cure, right? To keep our sodium levels balanced, it's important to stay hydrated, especially when it's hot out or we're sweating a lot. But remember, too much water can be just as bad as not enough. If we have a medical condition that increases our risk of hyponatremia, it's crucial to follow our doctor's advice and keep a close eye on our symptoms. Remember, staying informed and taking care of our bodies is the best way to stay healthy and happy.